Welcome to another edition of A New Me. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location at the Krupp Center for Maxillofacial, Oral, and Cosmetic Surgery in Baltimore, Maryland, discussing the latest advances in dental implants and facial rejuvenation, and how they can give you the healthy smile and younger, fresh look that you've always desired, with this area's top oral surgeon, Dr. Bernard Krupp. Dr. Krupp is board certified and received his dental degree from the University of Maryland and completed his residency in oral and maxillofacial surgery at the Washington Hospital Center. Dr. Krupp is a member of the American Academy of Cosmetic Surgery, the American Academy of Implant Dentistry, and the American College of Oral and Maxillofacial Surgery, among others. Welcome, Dr. Krupp.
Thank you. It's great to be here.
Oh, it's our pleasure to have you on. Your first time, in fact, on A New Me. We've got a lot to talk about. You're going to educate us on some latest advances in dental implants and facial rejuvenation. I understand there are several patients that are waiting to come on as well.
I'm going to do my best.
Yeah, we'll certainly look forward to it. And let me begin, if I may, by asking you to tell us what dental implants are.
Well, dental implants are a replacement, metal replacement, usually titanium, but can be other metals, that replaces a natural tooth that has been injured, infected, traumatized, and it can be either an individual tooth or it can be multiple teeth. For instance, we have a procedure that we do called Teeth in an Hour, and we have another procedure called Teeth in a Day, where we can take a patient who has no teeth, they're wearing dentures, and they can come into the office and leave with dentures that are fixed permanently to their jaws, all in one day.
My goodness, that's very impressive.
It's a pretty impressive procedure, and it works and has a long-term efficiency that is terrific.
And what problems do these dental implants correct? I know you just touched on one of them a moment ago, but if you could please elaborate for the viewers.
Absolutely. We really care about the way these implants affect people's lives. For instance, when someone's missing all of their teeth and they're wearing dentures, not only does it sink in their face and their jowls, so it has a rejuvenatory effect, it also allows patients to chew foods that they haven't been able to chew for years. Bagels, peanuts, carrots. You know, we don't want them to be chewing jujubes or things that are really, really sticky, but they can. Yes. And it's, for me and for my team, a joy to see the transformation in a patient who's gone from wearing dentures and using the pastes that they have to buy to having teeth that are fixed, look natural, and they're able to speak normally.
They get their lives back and their confidence back and the normal function that they may have lost, as you said, is due to the problems they had.
They do lose it, and this is a terrific confidence builder. Plus, when you lose your back teeth, it really kind of pushes in your cheeks, so you look a lot older. And most of the time, when dentures are made, they're really not necessarily made with rejuvenation in mind, and so you see patients who are wearing dentures that you're not even sure they have teeth in their mouth. Yeah. So this is a total wonderful makeover for these patients. But even for a patient that's got a single tooth in the front, for instance, if you lost your front tooth, yes, and you don't want to walk around with a tooth that's missing, and what are your options? You can wear a partial denture. You can have braces to try to close the space. There are a lot of things that you could do, but the most natural thing is to replace that missing tooth with a dental implant, and it works.
Well, we're going to be seeing those results very shortly, not to mention patients coming on who had them as well.
Absolutely.
But I wanted to ask you, Doctor, if you can tell us now about these latest advances in dental implants so we have a better understanding of what here at the Krupp Center is available to us through you.
Well, we were the first center to have what's called a CT scanner, cone beam CT, that allowed me to visualize three-dimensionally the patient's bone, their bone volume, the bone density, and the ability for me to plan the placement of the dental implant in the jaw structure on my computer screen before I did it in the patient.
My God, the advances in technology, right?
It's unbelievable. This technology is really only about 4 or 5 years old. I jumped on it as soon as I knew it was available, and it's been unbelievable in terms of realistically being able to predict the type of patients that we can treat and to treat them more successfully than ever before. In fact, patients who come to me sometimes come because no one else can treat them. They have such wearing away, or it's called atrophy of the jaw, that they have no other options. And they are told by many surgeons that they can't wear anything except for a denture. And they come to us and we're able to plan something that is called a graftless solution that allows me to use very long implants to go up from inside the mouth to the cheekbone, called the zygoma implant, and the pterygoid implant, which is in the back of the mouth. And even patients that have been told they'll never be able to have a permanent solution can.
My goodness. So this is now available to us that not too many years ago wasn't.
This is new technology.
Yes.
The other part of the new technology is that the dental implants today are far better designed than they've ever been before. The companies that I work with are the best companies in the world. They have the largest market share of anyone in the world. They devote a lot of time and energy and research to make sure that they know that this is going to work. And in my hands, it's worked beautifully.
Well, you're like the artist that puts it all together onto the canvas, which are the patients, and help them.
And the patients really have to learn how to follow the specific instructions that we give them to do well. It's a two-way street. My job is to educate and be able to deliver. The patients need to understand and follow through.
Yes, indeed. A very good point. Now, Dr. Krupp, who's a good candidate?
Realistically, anyone is a good candidate. And it depends on the extent to which the patient needs the number of dental implants. Obviously, if someone is a severe brittle diabetic, they're not someone who's necessarily going to be interested in this procedure. As long as the patient is relatively healthy, has high blood pressure, has diabetes, but they take care of themselves. This is a procedure that is really across the board, is going to benefit anyone who wants to chew better. And there are occasional failures when you place implants. We place 400, 500, 600 implants a year and have been for almost 25 years. It's a lot of patients that we follow over a long period of time. So we like to follow our successes, and occasionally we see our failures too. And over this number of years, there has been a dramatic increase in longevity of these implants and in the design of the implants to make them even better.
Well, that's certainly very impressive, and by having a track record that long as you do and providing all these many thousands of patients over the years with the dental implants, you've seen the progressions and you can track everything like you just mentioned as well.
Right.
Now, for the patients out there who are watching and are interested in dental implants, what's a typical process? I'm sure it varies patient by patient, but just so we have an idea of what they'd be looking at when they first contact the Krupp Center.
Well, there's a process that we follow, and the process is pretty standardized. If you came in for a dental implant consult, we would obtain the CT scan, do a consultation process. During that consult, we use different props, videos. Usually there's 2 or 3 patients in my office who have had the procedure that you're looking for. So they can even come in and sit in and kind of tell you their personal experience, which is really wonderful.
Yes.
But basically, for instance, this morning I did a couple of implants on a young man who left the office, calls at 4 o'clock in the afternoon, very little discomfort, very little swelling. He's very pleased with the procedure, but most people are going to have some discomfort for at least a few days. The more, in terms of the number of implants, and the more complicated the procedure, the harder the post-op recovery obviously is. I alluded to very specific types of implants earlier called zygoma and pterygoid implants because they're in very specific parts of the upper jaw when there's no other solution. Those patients have a little bit longer recovery.
Okay.
But for the mainstay of a patient who comes in with good bone and is healthy, it's a very limited post-op recovery.
Very interesting, Dr. Krupp. I wanted to follow up by asking you, how long typically does it last to have this procedure done where we get dental implants from when we come in?
All right, so if you come in for the actual day of the procedure, and I'm going to place, let's say, 1 implant, the actual time in my operating room is going to be about 20 minutes.
That's it.
That's it. If you're coming in for 6 implants, let's say for a fixed upper or lower bridge, and we're going to attach it that day, and let's assume maybe that your dentist is going to be there at the same time, it could be an hour. Now, it sounds a little bit different between 20 minutes for 1 and an hour for 6, but remember the dentist is there, and this is a very specialized procedure called teeth in an hour. Typically, the cases that I do that are guided, meaning that I've put them on the CT scanner, put them on my computer to look at them three-dimensionally, visually place the implants. Those are cases that the patients do very well. They're very quick to place the implants during the surgery, and the teeth can actually be made or pre-made so the dentist can come to my office and put them in, and they can be in and out of my office within an hour.
My goodness, so for all those busy professionals, for example, that are out there, they can come in during their lunchtime, literally, and as you just said, teeth in an hour when they walk out.
They certainly can, but we probably don't want them to go back to work.
Yes.
Yeah, right yet.
Okay.
But typically it can be an hour. Some of the more intricate, more grafting procedures where patients don't have bone, and I need to do more reconstructive work, those cases take longer. But even those cases, you're really talking about between an hour and a half to 3 hours.
So it's not very time consuming at all to get the results that obviously we all want.
And what's most important is not the length of time it takes me to do it. Is we want to look at the end product.
Yes.
What does it look like when everything's healed?
Yes.
What do you look like with your new teeth? What do you look like with your new smile and that confidence that you build?
Yes.
And you've generated.
That's right.
By feeling good about yourself. That's what we're interested in.
They become a new me. They get that confidence
A
back
new
that
me.
they had lost. Yes.
That's it.
That's right. Now, speaking of results, can you tell us a little bit more in detail about what type of results they're looking, that people should expect from dental implants?
Well, people should expect natural-looking dentition, natural-looking teeth. You know, some patients will request very, very white teeth, and that's up between them and their dentist. You know, for my part, I tell the patients to expect to look natural. I'd like to see them look more youthful.
Yes.
You know, I don't want them to look like they're walking around with a denture or something that everyone else that we've treated looks like. Each person is individual. We plan the case individually. We do a treatment plan for everyone to make sure that everyone is on the same page and understands what's going to be to their best benefit.
Yes, no, very well said. That's exactly right, because when one has a cosmetic treatment done, no matter what it is, whether it's dental related or facial cosmetic surgery, nobody wants to look like they're done when they actually were done. You want it to be as natural as possible.
My middle name is Natural. I want my patients to look great, but nobody really know why.
Yes, indeed. Now, I believe you have some patient before and after pictures, Dr. Krupp.
We do.
Let's take a look at them.
All right. So here we have a number of patients that we've treated over many years. Some of our patients have been coming to me for many years, over 15 or almost 20 years. And they come in for repeated rejuvenation, or if they're missing a tooth, they come in to have a tooth replaced. So you can kind of see from the before and afters on my cosmetic patients how we look at natural postoperative results for a facelift, for eyelid surgery, for skin resurfacing. And you can also see that some of my patients kind of translate between having dental implants and having a facelift. And some of the patients go from having a facelift and realizing the value when they've lost their posterior teeth to having dental implants. So it's very synergistic, but the pre and post-ops really speak for themselves.
Very impressive results, Dr. Krupp, and what really stood out was what you had just touched on, and that is that everything looks so natural. That is your middle name over here.
Thank you. Thank you.
Great work.
Appreciate it.
Now, how long do these results from the dental implants typically last? Again, I'm sure it varies patient by patient, but in general, so we have an idea.
With the new technology and the new design of the implants, our expectation is that they're going to last pretty much forever. If the patient takes care of their teeth, barring accident or injury, my expectation is, and I follow these patients every year. So if I place an implant for you, I'm going to see you every year until either one of us moves away or isn't here anymore, and that way I'll really have the final answer. But my expectation is I'm seeing patients that I treated 25 years ago, and they are still doing great. Those patients who take care of themselves are going to continue to really appreciate the fact that they can chew.
So really, based on what you just said, we're looking at the results that last a lifetime.
We sure hope so.
Yes. Are there any follow-up visits after the dental implants procedure, as far as them coming back periodically just to have a look-see by you?
Yeah, absolutely. In fact, it forges a long-term relationship for me.
Yeah.
And as you can see by the patients that you've interviewed, these patients are really committed. They're committed to my team. They're committed to my office. They want what's in their best interest as well. And the way that that occurs is that I expect, and I have a conversation with each patient prior to my treatment, that I'm going to want to see them minimally once a year forever. And they need to fulfill that commitment because my eyes need to see the work that was done to make sure that they're doing well. Yes. And that's my commitment. They also see their general dentist or whoever restored the teeth, and that's fine. But I want to see the work that was done by me at least once a year.
I wish more practices had that philosophy. Now, I also understand, Dr. Krupp, that your practice, Krupp Center, also offers facial rejuvenation, obviously procedures and treatment options that cover many different areas.
They do.
And you have some latest advances, not only in dental implants that we've covered thus far predominantly, but also in the arena of facial rejuvenation. And I wanted to ask you if you can please tell us about what they are as well.
Rocco, they are really basically the same ideas that we use in dental implants as we do in facial cosmetic surgery. I'm basically a head and neck surgeon. I'm trained as an oral maxillofacial surgeon, which encompasses the jaws and the surrounding structures. So every day I'm just looking at everybody from here up.
Yes.
Makes it easy. There are 15 to 20 procedures that I do on a daily basis, and I try to do them the best that I can. The synergy between dental implants and facial rejuvenation is incredible because you see patients for facial rejuvenation who are wearing dentures. I can do a great facelift. But if their teeth look terrible, it ruins the whole deal.
Yes.
So I'm aware of that, which I don't think a lot of surgeons necessarily are from different backgrounds and different training. I think that's one big plus in my center. So we do offer rejuvenation from skin to bone. Skin care, bone implants, cheek implants, chin implants, jaw implants, orbital implants, Botox, Dysport, all of the injectables that you can think of. The most wonderful thing that we have is the ability with my wonderful esthetician to look at patients skin deep by using something very special called the Visia analysis. The Visia is a special light-based photography device that allows me to see the number of bacteria on your skin, the number in terms of pore size of the skin, the wrinkles, what's underneath the skin and getting ready to come out in terms of sun damage. Every skincare patient starts out with this. So we have a baseline, and I can then objectively look at a treatment plan that includes not only just redirecting skin, but looking and treating the skin at its root cause at the surface level.
Very impressive indeed. More advances in technology that you utilized in this part as well as the dental side. And from what you described, being an oral surgeon, you were mentioning a few moments ago that when you look at patients, you look basically from here on up.
Right.
You look for that balance and harmony as well, I'm sure, to make sure how things can be properly aligned and how everything can complement each other, because in many ways, you're right, the dental side and the facial side are really intertwined in many ways.
Well, they are intertwined, and we also know from looking at aging studies today that have been done conclusively and looking at cadavers over time that as we get older, the bones also change. They shrink. Yes. They become smaller. Our faces change. Our noses change. The skin changes. The drape of our face changes. So my job is to come up with a treatment plan that allows for an anti-aging program. Sometimes that anti-aging program deals basically just with non-surgical entities. Okay. And I have lots of different lasers and treatments in my office that are all state-of-the-art. Sometimes you need a lift.
Yes.
A lift is a lift, and it makes a big difference. So it's really important to kind of be able to look at all of the different tools that we have, put them together in such a way that it's a programmed approach, although it's individualized for each patient, that allows the patient to look as good as they feel.
Now, some of these procedures and treatment options on the facial rejuvenation side, for our viewers that are watching,
the non-surgical
Yes.
treatments might be, for instance, thermage, which is a type of laser, radiofrequency laser. It might be the Fraxel, which is another type of a laser. It could be a fractional carbon dioxide laser, which is a third type of laser. It could be different types of chemical peels that go to varying depths of the skin. It could be acne treatments. Could be my own skincare line, which is, by the way, called Skin.
Okay.
It can be a lot of different ways of promoting anti-aging. We also then do more invasive, obviously, in terms of building chins, building jaws, building faces,